To begin with our lecture, what is ergonomics in laparoscopic surgery? It is nothing but it applies the same principle what is used for dragging. So any kind of activity or position which a man adjusts with the machine to make his life comfortable, safe and effective is ergonomics. So if I had to really divide this lecture, I will divide that lecture into two parts. First is the ergonomics of table and trolley, that means how your arrangement should be there about the trolley and the table. The second part is the ports placement. The ports placement, again I will divide that into two parts. Principles of ports placement and ports placement for a surgery specific, that means be it cholecystectomy, be it appendectomy. But we are not going to talk in detail about this because individual surgery has an individual port placement. So it will be a 2 hours topic, we are not going to discuss this, but what is more important for you to understand, what are the principles or what is the thing which is going back of your mind to decide how the ports has to be placed. Okay. First we'll come to ergonomics of OT table and trolley. Okay. First and foremost important thing is the OT table. Why don't you go sit a little behind? Sit a little behind. For me it becomes very uncomfortable. Okay. So first is OT table. Okay. The kind of OT table what you operate or do a laparoscopic surgery, mind you, is not an ideal laparoscopic table. It is a jugaad what we do. That means we actually tend to operate an open surgery in a table which is not designed for a laparoscopic surgery. So indirectly I am asking you, what are the factors which will decide that this is a good laparoscopic table? You understood what I am trying to tell you? That means the OT table what you are operating is nothing but a jugaad that eventually you are saving on the cost and you are performing the same kind of or basically you are not changing the table and you are performing a laparoscopic surgery on an open trolley. Okay. So what is so specific about a laparoscopic table? What do you think could be the basic difference? Or when you go, when you know that you are going to perform a high-end laparoscopic procedures, that means when their quantity is going to be huge enough, you really need to have a good laparoscopic table. So what are the factors that will decide that this is a good laparoscopic table, at least a good basic laparoscopic table? What do you think?
It can change position according to the surgery, specific body restraints are there.
What do you mean by body restrictions?
Body restraints, supports, the restraints that can be
But
used
that can
to
be
fix the
available
body.
in an open table. Even an open table provides all this kind of things. What do you see? Change of position, the supports. Isn't it available for an open trolley or an open table?
Not specific to a laparoscopic setup. No?
We can have, if we go and to buy a good open table, we can have all these kind of things what you are trying to tell me. What is so specific about laparoscopic trolley? So first is the height. First and foremost thing when you go to buy a laparoscopic table, see that at what height it goes just below the ground or above the ground. Okay, a laparoscopic table is a good laparoscopic table if it goes at least 1 feet above the ground. Because sometimes there are morbidly obese patients and if you're a short surgeon or if you're a tall surgeon, the things becomes very much difficult. Okay, so you either have to stoop low or you have to basically strain your shoulders and wrist joint. Okay, so an ideal laparoscopic table is the one which goes at least 1 feet above the ground. Okay, it's like going to a party and having a food or having a dinner with a plate in your hand. Okay, so I'm going to give you two situations where I put the laparoscopic table very high and other scenario where the laparoscopic table is too low. Okay, so imagine a situation, you're going to a party and you're carrying a plate of food in your hand. Are you comfortable eating at this height? Are you comfortable? That means there has to be a certain points which decide that this is a comfortable position for me. Okay, I'll come to that, but just imagine a scenario where you are eating like this. Is this a good ergonomic position to perform a laparoscopic table for other eating? No. Why do you think this is not a good position to eat? That means I kept a plate here, somewhere here, and I'm eating. Is it a good position for me to eat? No. What happens?
Shoulder movements next.
So which are the two joints which are commonly involved here? Which are the two joints which are going to create a problem in future? Elbow or something else?
Wrist and shoulder.
Wrist and shoulder. Okay, the first joint which comes into picture is the shoulder joint. Okay, this is your anatomical relaxing position. Shoulder little bit abducted. But imagine a scenario where your table is at a very high height. Okay, so if your table is at a very heighted level, Imagine operating like this. So there is an excessive abduction at the shoulder. If it is a small surgery, you still, and if you are a good laparoscopic surgeon, you are still able to manage this kind of surgery. But imagine a scenario if you are performing an advanced laparoscopic procedure, which is going to take a lot of time. Is this a comfortable position? No. So your shoulder joint is going to create a problem in future. Okay, so not a good position at this height. Any other joint which can create a problem with this height? Any other joints? You already said that. Wrist joint. What do you think is happening at the wrist joint? What do you think is happening at the wrist joint? As I said, in shoulder there is an excessive abduction, which is not a comfortable position. Okay, so similar kind of thing is also happening at the wrist joint. So what is exactly happening at the wrist joint?
Excessive flexion. We have to flex.
Flexion, and what is more important thing which is happening if the table height is at a very high level? There is an inward rotation at the wrist joint. Okay, so this kind of position, do you think this position where your wrist is flexed and there is an inward rotation a good position for your wrist? Okay, so definitely this is not a good position, because eventually this is going to cause a lot of wrist pain. Okay, wrist stiffness. Okay, so problem with a height which is very high, performing a laparoscopic surgery, two joints are going to create a problem to you. One is the shoulder joint, which is because of excessive abduction, and wrist joint because which there is an excessive flexion and inward rotation at the wrist joint. Okay, so definitely a heighted level is not a good option. Exactly ulta scenario, if I put my plate too low, okay, is again that a good position? Is again that a good position? No. Why no? What happens if the table is too low? What?
Back strain.
Exactly. So the joint which comes into picture is a spine joint. Okay. So in case I keep on performing stooping my back, eventually I am going to have a back pain. Okay. So again, definitely this is not a good position. So too high always has a disadvantage. Too low also has a disadvantage. So ideally they come to a situation where there is some comfortable position. As a laparoscopic surgeon, you find it much comfortable or much easier. What is that position? That means indirectly I am asking you which is the comfortable position, or how you should adjust the laparoscopic height. Your boss comes and tells you, doctor, I am going to operate a lap cholecystectomy, adjust the laparoscopic height for me. So what is the criteria that will decide that this is an ideal laparoscopic height?
90 degree flexion. Elbow should be at 90 degree flexion.
90 degree. Do you think this is a comfortable position? Is it more of an elbow, or is more, as I said, it's more of a shoulder joint and the wrist joint? Okay, don't talk about elbow. Elbow, whichever usually the flexion happens, is quite comfortable. So even if this position elbow is quite comfortable, even if it's a flexion at this level, it's quite comfortable. The problem actually happens at the shoulder joint, and the problem happens at the wrist joint. So which is the comfortable position?
Shoulder, mild abduction.
A position where your shoulder is mildly abducted, because this is a much relaxing position, and you have to see that the handle of the instrument and your elbow joint are at the same level. Okay, look at this fellow. He's almost, I will not say at the same level, but usually the forearm and wrist joint are at the same coaxial plane. That means there is no inward rotation, there is no external rotation. The wrist joint is not flexed. So your handle of the instrument should be in such a way that it is at the level of elbow. So this is a much comfortable position for you to operate, where your arms are a little bit abducted, no movements or no flexion or extension at the wrist joint. Okay, so this is the best comfortable position for you as a laparoscopic surgeon to perform an advanced laparoscopic procedure. Too high, problem; too low, a problem. Okay, so this is the first point what I want to stress. That is the height of the OT table. Okay, height of the OT table. That means it has to go at least 1 feet above the ground, because sometimes we get a morbidly obese patient. Okay, so in that scenario we need a table to go very, very low. Any other points which will decide? Any other points which will decide whether it's a good OT table or no? Especially if you are performing a surgery at a gastroesophageal junction, what kind of position you will be comfortable operating, right side or left side? Exactly, so there has to be a leg split. So again, the second important criteria to decide whether it's a good laparoscopic table or no, you should see whether it's having a leg split or not, because most of your surgeries in advanced laparoscopic procedures, whether it's a G junction or even for that matter if you are performing an AR, because at times you need to sit in between the legs for firing a stapler. So you should always see whether there is a leg split or in open table you may not have a leg split. Okay, you may have a lithotomy but you may not have a leg split. So ideal laparoscopic table is the one first which basically has a good height, secondly which has got a good leg split, third definitely if you are operating on a morbidly obese patient, sometimes the patient's head has to be kept too high so that the stomach falls down. But if the patient or if the table is lifted very high, there is a chance that the patient might fall up. So there has to be a good support. Okay, so there has to be a good leg stirrups or a good leg support. So when you're basically the third important point is a support. So these are at least the minimal 3 criteria which will decide whether your OT table is suited as a laparoscopic table or no. Okay. Next important point is trolley. So the boss again comes to you, tells you, doctor, today we have posted one lap cholecystectomy. He tells to a registrar, we have posted one lap cholecystectomy. Now you place a laparoscopic trolley for me in a particular position. So what are the factors again which will decide? What are the factors again which will decide how your laparoscopic table should be? Okay, for example, suppose this is the OT table, this is the head end of the patient, this is the leg end of the patient. I am performing a cholecystectomy. Okay, I am standing on the left hand side of the patient. Okay, I will tell you one by one. So first point is how far should be the distance of the monitor from the surgeon. So this is the first factor, isn't it? That means first things which comes to your mind is how far I should place the laparoscopic trolley, isn't it? As a registrar, once the boss tells you put a laparoscopic table, the first thing which comes to your mind, how far should be the laparoscopic table. So again, what are the way we have decided the factors for the OT table, there are certain factors which will decide how far should be the monitor from the surgeon. And what are those factors? What is that important factor?
The neck should not get either flexion or extension. The neck should be.
So suppose, is it okay to keep a laparoscopic trolley even at that level? Now there is no flexion, there is no extension.
Depend on the screen
No,
size.
no extension, no flexion.
Screen size.
Exactly. So what he says is exactly right. That depends upon the screen size. Sometimes you are using a smaller monitor, sometimes you are using a big monitor. So depending upon the size of monitor, the distance of the surgeon from the monitor changes. And what is the factor which decides what the size? How do you decide the monitor size? The diagonal diameter decides the size of the monitor. Okay. When I mean by 32-inch monitor, this is the diagonal diameter of the monitor which decides whether it's 32 inch or 48 inch. When I mean by 32 inch, it's a diagonal diameter of the monitor. Okay. Now, what are the, suppose I'm using a 32-inch monitor. What is the thing which decides how far should be the trolley? Is there a particular measurement or is there a particular rule to decide that?
So ideally 1.5 to 3 times the size of the
It has to be multiplied by 5 times. Okay, it has to be multiplied by 5 times to achieve a good ideal distance to perform a laparoscopic surgery. Okay, how did I come to this particular factor of 5? That means if it's a 32-inch monitor, multiply that by 5, so whatever it comes to 160 inches. So distance of a surgeon from the monitor should be 160 inches ideal. How did I come to this particular factor of factor 5 or number 5? There is something called as macula in our anatomy. What is so typical feature about a macula? What is a typical feature about a macula?
highest concentration.
Highest concentration of
Cones.
cones, which is concerned with
Equity.
color. Okay, C for color, C for cones. Okay, so there is something called as a macula in our eye, which contains a highest quantity of cones which are concerned with colored vision. So when I multiply this by 5, okay, the maximum image falls on the macula. So the clarity is good. Again here, imagine two situations where your monitor is too close or monitor is too far. What will happen if the monitor is too close? So this is the ideal, suppose this is the ideal one. Imagine a situation if the monitor is too close.
Too much of accommodation.
So here, apart from putting the image onto a macula, the image of the monitor is also going to the area which is next to macula. So again the clarity will be lost. Okay, definitely you'll be able to see the picture, but not as good as this, because here everything is falling on the macula. Here some part of it is falling on the macula and some part of it is falling next to macula. So not a good position. Exactly ulta situation, opposite situation, where your monitor is too far, that means more than 5, suppose it's 8 or 10. What happens in this case?
So in front of the mac.
Focus will be
In front,
Focus will be.
that means apart from this monitor, if there are suppose some frames here or some microscopes here or something, even that image will fall onto a macula. That means along with the monitor, there are certain images which are apart from the monitor, which is also falling on the macula. Understood or no?
Visual field will increase.
Okay, so suppose this is a monitor, this is an ideal site for me to keep a monitor. But if I keep it too far, along with that microscope, I am seeing that electrical circuit, I am seeing this microscope, I am seeing that chair. So that is going to disturb my concentration. Okay, too close again will be an uncomfortable position for me. Okay, imagine a situation if you are going to a theatre, do you always book a first row ticket? That means, do you book a ticket which is very close to the screen? No, because at times you will have to see on the left hand side, at times you have to see on the right hand side, but you won't be able to accommodate the entire picture in your field of vision. Okay, so too close is not a good position. That's the reason actually why we book a balcony ticket, because then we can easily accommodate the entire screen in our macula. That is how we have come to this factor of factor 5. Okay, so too close a position, too distant a position is not a good position for laparoscopic table. So depending upon the size of monitor, the diagonal size multiplied by 5 should be the ideal length of the monitor from the surgeon. Okay, so that is the first part. Understood? Second part. So first part of the trolley is the distance. So first is the distance. The second important part, again, suppose again a similar situation, this is the patient, head and leg end. You have been performing a laparoscopic cholecystectomy. The first case is laparoscopic cholecystectomy. You have put the trolley here, okay, at the head end of the patient, suppose. Will that position will apply similar in case even if you are doing a lap appendectomy? Will that be a good position to have a trolley even if you are performing a lap appendectomy as your second case? No. Why no?
The target or the monitor should be in
Direction will change.
Same.
It has to be in the same
So what
line.
is that factor which decides whether your laparoscopic trolley should be at the head end or it should be at the leg end?
If we are performing appendicectomy, we'll prefer it in the leg end. If you are
Why? That means what is happening here? Everything, water is very easy to understand, but you never thought of that. Okay, it's very easy to understand. You have been doing in and out, but ऐसा क्यों रखते हैं पैर के इधर क्यों रखते हैं
the
ऊपर?
surgeon will operate from the upper.
That means the ideal principle behind this is the surgeon, the target organ and the monitor should be in the same coaxial line. Okay. In fact, that is the reason why initially we always struggle as a hernia surgeon, because then it becomes very difficult. That means suppose the hernia is here, you are operating here, you can't put a monitor here. Sometimes the monitor is very on the left hand side, so it becomes very difficult. So initially the surgeons struggle, but as you keep on doing the hernia surgery, then you become expert in that, and then you're still able to manage to do a hernia surgery. But to begin with, if you are a new laparoscopic surgeon or you are just a trainee, you should always see, or the principle behind this particular position is the surgeon, the site of pathology and the monitor should be in the same coaxial line. 15 degrees here and there is still okay. Okay, it's like, for example, suppose if I tell you, suppose this is a page, okay, and this is a book. I tell you to copy the matter from this page onto this book. Okay, will you be comfortable putting the page here and then copying, or will you be comfortable putting the page here and then copying? Because every time you have to move your neck and then copy. So is it comfortable for you? Best thing is to put it here, just blink your eyes up and copy. Isn't it that comfortable position? That means what is happening here, I might tap this particular book and the target from which I am copying are in the same line. So this is a much comfortable position. So the same thing applies even for a laparoscopic surgery. Your most of the things should fall in the same coaxial line. 15 degrees here and there still okay. That means 15 degree movement of neck still okay. But anything which is more than 15 degree is going to create a neck problem. Okay. In fact, that is the reason why you always take a center place. Now in theatre again, the same thing applies even for the way you go to watch a movie. Why you prefer in the center? Because that is the most simpler coaxial line for you. Because everything falls in the plane. But suppose you are taking a corner seat, that means you are watching it like this. Is it a comfortable position for you? No. The same thing applies even for a laparoscopic surgery. So the surgeon, the target organ and the monitor should be in the same line. So that is the second principle. Okay. Third. What is the third one? What do you think? You already said that initially.
Height of the
Height. That means you had adjusted the distance properly. You had kept the trolley or the position of the trolley properly. Now here comes what should be the height of the monitor. That means whether it should be too high or whether it should be too low.
is in the neutral position, I suppose.
What is the, that means indirectly I am asking what is the neutral position for you to be comfortable?
Slightly
15 degrees.
Again same thing, 15 degree little bit flex. That means 15 degree at least low from the eye level. Okay, suppose your eye level is this thing, that means just look 15 degrees below. This is the much comfortable position for you, because here the neck muscles are maximally relaxed, the oculomotors are maximally relaxed. Okay, if you tend to keep it at a higher level, that means again two scenario. If you tend to keep it at a higher level, okay, that means again imagine a situation, again taking a front row in theatre. Will you be able to comfortably watch the movie or perform a surgery? No, because there is excessive extension. So chota movie rahega 10-15 minutes, you are still comfortable. But if it's a longer movie for 2-3 hours, it becomes difficult. When you come back out of the theatre, you have a significant neck pain. Exactly situation. Suppose the trolley is very low, the TV is very low. Again, for example, the person who is in the habit of regularly seeing the mobile or WhatsApp on the mobile, he tends to get neck pain because here there is an excessive flexion of the neck. Okay, so most comfortable position for a laparoscopic table is such a way that the monitor is 15 degrees below his eye level. So these are the important ergonomic factors which should be taken care of when you are performing a laparoscopic surgery. Okay, so about the OT table and the trolley. Clear this part? Now we'll come to the most important part about the port placement. Okay. Here we come to the most important part of port placement. And what you should understand in port placement, that the port placements are not randomly done. There is idea or there is a particular process which always goes behind the surgeon's mind. That means what should be the most comfortable position for me to put a port, so that even if I am performing surgery for 3 to 4 hours, I should be comfortable. My surgery should be very, very effective. That means the result should be good. No matter even if I am doing suturing, I should be comfortable, and ultimately patient should be safe. Okay. So that means I am going to talk here about the principles of port placement and what that applies, or what is the principle on which your ports are placed.
Triangulation. Triangulation.
What is that called?
Baseball rule.
Baseball.
Baseball diamond concept. Baseball or a diamond concept. So whenever we put ports, we put the ports according to this concept, baseball or a diamond concept. Why baseball? Because the ground of baseball has got a similar shape as what we put the ports. Okay, I'll show it. So it is something like that. Suppose you are performing a lap cholecystectomy. What do I mean by baseball diamond concept? That means here is your gallbladder, here is your telescope, here is your right hand, and here is your left hand. So the arc what is formed here this is your gallbladder, right port, telescopic port, and your left hand port. Okay, so it is like this. Okay, this port may be a little higher. So this is your right port, this is the telescopic port, and this is the left hand port. This is what you regularly put your ports for a cholecystectomy. Now the first principle of this baseball diamond concept is your telescope has to be in the center. Okay, why telescope has to be at the center. Why I can't put a telescope here and this is my right hand, this is my left hand. You understood what I'm talking about? We follow the principle of baseball diamond concept when we put up ports. Okay, the first principle of this baseball diamond concept, your telescope always has to be at the center. Why at the center? Why not a telescope come at the right port or the left port? Why we always need to put a telescope here?
Both sides.
Both sides have to be same.
Both the sides means what?
Means the angle of vision increases. If we put the telescope at one side, the angle of field of vision decreases. So
Field of vision is basically determined by the optical axis and the size of the telescope. So field of vision remains same. See, just imagine a simple scenario. Why God has given eyes in the center of right and left hand, so that our eyes and eventually the brain recognizes my right hand and my left hand are of the same size. So they are equally compatible. Some people are right-handed, some people are left-handed. But for me as a brain, when I'm thinking, for my eyes, my right hand and left hand are same. Imagine a situation if my eyes are shifted onto one side. So what my eyes think is, my right hand, this left hand is much closer. So this is much bigger as compared to this hand. Okay, so that is one. Secondly, when we operate in that way. That means always the eyes has to be at the center. Okay, and your right hand comes from here, left hand comes from here. The same principle applies even for laparoscopic surgery. Your telescope is nothing but your eyes. So eyes is at the center, your right hand is giving the right port, your left hand is giving your left port. Okay, so that's why this is the natural comfortable position to have a telescope inside. Okay, that is one. Second reason, again imagine a situation where I put my right hand here, my left hand here, and here is the telescope. What will happen? What will happen?
Those instruments can clash.
That means the instruments will come very close, no? That means the hands will come closer. So my instruments are going to fight against each other. That is one. Secondly, any kind of procedure in case I want to do, for example, suturing is going to be difficult. So this is the much comfortable position. Okay, so that's why always telescope has to be at the center. And again, which is the most comfortable side to put in the telescope? Suppose your boss comes and tells you, or boss is basically stuck in the traffic, and it tells the registrar, doctor, just put a first port, I am on my way. So which is the best port? The safe bet obviously has to be an umbilicus. Why umbilicus?
Center.
Because that forms almost the center of an abdominal cavity. So whether you are performing surgery at the upper abdomen, whether you are performing the surgery at the lower abdomen, still it is the best bet. It is never going to be wrong. It can be little bit haywire, but little bit here and there is still okay. But still, you are never going to be grossly wrong in putting a telescope on the umbilicus. Okay, and second reason, obviously, it gives a good cosmetic scar, cosmetic results. Okay, so first is telescope has to be at the center. Telescope preferably goes at the umbilicus. Okay. So first principle is about the telescope. First principle is about the telescope. Second principle is about the manipulation angle. What do I mean by manipulation angle?
The angle between the two arms and the target.
So imagine a similar situation again here. This is the abdominal cavity. Okay, this is the gallbladder. This is my right hand telescope, and this is my left hand. So angle formed by the right hand with the left hand, and right hand and the left hand with the target organ is nothing but the manipulation angle. Clear or no? Okay. That means indirectly now I'm going to ask you, what should be the normal manipulation angle?
45 to 60 degrees.
45 to 60 degrees.
60 degrees.
That means just imagine a situation. That means I'm asking which is the most comfortable for you to write. Isn't this a most comfortable position? Suppose I ask you to copy something from one particular azimuth angle. What is the importance of that? The manipulation angle was left port, right port, and the target organ. Azimuth angle is nothing but one of your port. Could be left port, could be a right port, telescope, and the organ. Okay, so this angle and this angle combined together, or this angle is azimuth angle 1, this angle is azimuth angle 2. So two azimuth angles addition becomes a manipulation angle. Understood or no? So the angle between the telescope and either of the port is an azimuth angle. And normally how much should be the azimuth angle? half of the manipulation angle. That means ideally it has to be 30 degree, but 15 degree here and there, still you are able to have a good comfortable operating position. Why that leverage of 15 degrees? Suppose, again I'll give you a similar situation where your lecturer is stuck in the traffic. He tells doctor, I'm just on my way, put the telescopic port and put the first port also now. So by mistake you are putting this port here. That means suppose by mistake your azimuth angle has become suppose 15 degree. Do you think there is still some advantage, or there is still some kind of rescue attempt which can be made here by the operating surgeon?
Second port
Exactly. So what he has now is, even though his one hand is 15 degree, he can have that rescue attempt by putting this particular port little bit far. That means this still can be 45 degrees. So that ultimately your manipulation angle becomes 45 degree plus 15 degree, that is still 60 degree. That means even if your azimuth angle on one side is 15 degree, you have that kind of independence to put your left hand port accordingly, so that eventually, even if you are performing any kind of surgery, the manipulation angles remain 60 degree. And what important is a manipulation angle, because then you are able to perform easily the task. Okay, so that is the advantage of azimuth angle. That means it gives a surgeon a liberty to correct his mistake by putting the other port. Okay, so that is azimuth angle. Any other angle have you heard of? And in fact, out of these three angles, this is the most important angle. Have you heard of elevation angle? So what is elevation angle? And I will tell you, out of all these three angles, the manipulation angle, the azimuth angle and the elevation angle is the most important angle. What is that elevation angle?
Angle between the target and the scope.
Target and the scope, or something else?
table
So the angle formed by the instrument with the surface of the body is the elevation angle. Understood or no? Okay, so simpler way. So angle formed by the instrument with the surface of the body is the elevation angle. Okay, how much should be the elevation angle?
15 to 30.
Normally again here the elevation angle should be 30 degree. Okay, have you ever wondered why we don't use a bariatric instruments for a pediatric patient? Okay, you want to do a lot of cost cutting. Okay, why just can't buy a simple long bariatric instrument and just use that thing for a pediatric patient? You are anyway going to use the same similar kind of instruments. What is happening here?
Maneuverability decreases.
Huh?
Maneuverability decreases because the leverage increases.
Leverage means what? You are basically absolutely into the right path and absolutely very close to the answer. Leverage means what happens? Why don't we use a bariatric instrument for a pediatric patient?
The fixed length of the port.
What is happening in this situation here? Suppose the angle I consider here is 30 degree. What is happening here? What kind of leverage is here? What kind of lever action is happening here? How many types of lever actions are there? 3. Type 1, type 2 and type 3. What is happening here is type 1 lever action. Can you give me an example of type 1 lever action? That means where your effort arm is as good as your load arm. That means whatever kind of efforts you are going to put, the ultimate generation of the load or the effect is same.
Like in
Seesaw. That means everything is balanced. Tarazu. Everything is balanced. आपने अगर 100 kg का वजन डाला है तो 100 kg का ही आपको प्रोडक्ट मिलेगा. So that is typically a type 1 lever where your effort arm and the load arm are same. That means similar thing happens in regular instruments what we use for an adult patient. That means here if the length of the instrument is 15 cm outside, similar length will be again inside. So whatever force you are applying outside, same force is generating inside. Whatever length of movement of instrument is happening outside, similar length of movement is happening inside. So this is acting like a type 1 lever. Okay, imagine a situation, suppose this is the ideal angle what I told you. So imagine a situation where this is suppose 10 cm and this is say 20 cm. What will happen? That means indirectly I am asking you, what will happen if this angle instead of being 30 degree, it is suppose 70 degree or 90 degree. That means you have put the port which is very close to the organ, what kind of leverage action it becomes?
More force outside, less.
Or ulta?
Ulta, sorry.
So it becomes a type 2 lever. Can you give me an example of type 2 lever? Suppose you are going through a highway, there is a big stone at night, and there is a big stone which has fallen in between. Okay, you are stuck. Okay, there is no one to help you out, but there is a rod which is falling next to the road. Okay, how will you remove that stone? Will it be okay if you just push the stone? Will the stone move? A big stone? So instead of pushing, just try to put the rod inside the stone, below the stone, and push the stone. So here the size of the stone is same. Even you as a person is same. The force what you are applying is same. But here, because you are making that as a type 2 lever, the stone is getting pushed. That means आप थोड़ा सा भी force लगाते हो, so that force gets multiplied. Okay, and that's why the stone starts moving. Similar thing happen here. If you are using a bariatric instrument for a pediatric patient, majority of instrument is outside and only a small part of your instrument is inside. So that acts like a type 2 lever. So इससे क्या होगा?
Effort gets multiplied.
So efforts gets multiplied. That means आप थोड़ा सा भी प्रेशर लगाओगे बाहर से तो अंदर जो भी organs है वो डैमेज हो जाएगा. That's why it is not feasible to use bariatric instrument in a pediatric patient. So now again come back to this. What will happen in case is 70 degree? So first disadvantage what happens here, or first disadvantage in case is 70 degree, that means in case your instrument is very close to the organ, is it acts like a type 2 lever. Understood or no? So that's the first disadvantage. If your elevation angle is more than 30 degree. Any other disadvantage you can think of? Any other disadvantage you can think of? Suppose you are making an omelette or making a chapati. Which is the best position to turn the chapati? Is it like this? Will you be able to turn the chapati or your omelette like this in a 90 degree position? आपका जो चम्मच है उससे आप हिला पाओगे ऑमलेट को? नहीं. तो ऑमलेट को हिलाने के लिए आपको 30 डिग्री लगता है ना. So same thing applies even for laparoscopic surgery. So any kind of manipulation of organ if you require, this position is going to create a problem. So that's why the second disadvantage of type 2 lever or port which is more than 30 degree is your manipulation of organ is going to be difficult. Third disadvantage, any other disadvantage? That means I am asking you, are there any other disadvantage of putting port which is very close to the organ?
Depth perception.
Depth perception, no. Any kind of injury which you think might happen? That means suppose this is your body surface, this is the gallbladder, this is the port what you pull, and this is the instrument which is coming out. So the chances of electrical injuries are very high. That means suppose if there is an insulation failure here of this instrument, this insulation failure of the instrument is basically getting conducted through the port, and suppose this port is touching the intestines, chances of this intestines getting an electrical burns is very, very high. So here the injury happens, okay, if the port is very close to the organ. That means indirectly the elevation angle is more than 30 degree, and that injury is more of a electrical injury. Okay, so these are the main three disadvantages of a port which has got an elevation angle of more than 30 degree. Okay, that means too close to organ. Exactly ulta situation or exactly opposite situation where your angle is suppose less than 30 degree. That means your port is too far from the primary pathology. Body surface again ideal height is 30 degree, but suppose you put the port here and your organ is here. That means suppose this angle is 15 degrees. Initially we talk what happens if it is 70 degree. Now we are going to talk what happens if it is 15 degree. That means I am asking you what are the disadvantage of this. Think in similar terms what we talk about 70 degree.
Type 3 lever.
So exactly now here it like a type 3 lever. What do you mean by type 3 lever?
More force outside, less inside.
Yes. So बाहर से आप कितना भी फोर्स लगाते हो, छोटा ऑर्गन भी रहेगा तो the things are not getting percolated similarly inside. Can you give me an example of type 3 lever? मछली पकड़ने के लिए जब ये जाला डालते हो ना, have you ever realized the fish is very small, but when you're trying to take it out, it appears to be very heavy. वो अगर आपके हाथ में मछली देगा तो it's very light, लेकिन आप वो rod से उठाओगे, so it becomes very heavy. So that is acting like a type 3 because it is acting right at the tip of your rod. The weight is right at the tip of your rod. So here it is acting like a type 3 lever. It's a classical example of type 3 lever. Similar things happens here. That means इस पे क्या होता है कि आप बाहर से बहुत फोर्स लगा रहे हो लेकिन अंदर कुछ फोर्स जनरेट ही नहीं हो रहा है. Okay, so same thing is happening here. It is acting like a type 3 lever. Any other problems in case your instruments is too close?
Reaching the organ becomes very.
Okay, that is what. Anything else? मतलब आपका जो एंगल है 15 डिग्री, मतलब आपका इंस्ट्रूमेंट जो आइडियली आना चाहिए ऐसा आ रहा है, तो क्या होगा? बेंड नहीं, और क्या है?
Restricted.
Do you think restrictions of what?
This thing, vertical motion, movement.
So the movement of your instruments are going to be problematic. The handle of the instrument is going to press the surface of the body, so ergonomically not a comfortable position. Okay, so any kind of manipulation of the organ inside which this position is going to be difficult. So again here the manipulation is going to be similar way what we had in 70 degree. That means the manipulation is going to be difficult. Even this, the manipulation is going to be difficult. Okay. And what was the third disadvantage what I said with this angle? Injuries. There it was an electrical injury. What kind of injury do you anticipate here? That means this is the body surface, this is a telescope what I really expect, 30 degree, but you have put the port suppose here, that means 15 degree. आपका आँख आगे है और आपका जो इंस्ट्रूमेंट है वो ब्लाइंडली आ रहा है पीछे से, समझा नहीं समझा? ठीक है, your eyes are here and they are looking forward, isn't it? But you have put the port which is very far from your eyes. So this part of your port, of this part of your instrument are going to be blind. So इसमें भी इंजरी होगा. समझो अगर इधर बाउल है और आपने इंस्ट्रूमेंट डाला, कोई भी सीजर डाला हो जो ओपन है, or for that matter even a hook, if you are putting it from this port, isn't it going to cause an injury? So this type of port placement is also going to cause an injury, but here it is going to be more of a physical injury. Okay, so understood, this is the disadvantage of having an elevation angle which is less than 15 degree. So here we come to the end of ergonomics of laparoscopic surgery. So just to summarize, what do you mean by ergonomics? Ergonomics is nothing but how a laparoscopic surgeon adjusts to the machine. The machines here are the laparoscopic trolley and the laparoscopic table to make his surgery much comfortable for himself, much effective in terms of results and much safer for the patient. This is an ergonomics. Divided that into OT table, trolley, and second is a poles. OT table and trolley again I can have in multiple discussions here. OT table, more important is the OT height, at least has to be 1 feet from the ground. Okay, then it should have a leg split. And third important point, it should have a good support in case you are operating on a morbidly obese patient. Laparoscopic trolley, most important thing is the distance of the monitor from the surgeon, which has to be 5 times the size of the monitor. Second important thing, it has to be in the same coaxial line. And third important thing, it has to be 15 degree below your eye level. Coming to the ports, principles of port placement is applicable as per the baseball diamond concept. What is the baseball diamond concept? The first important point is telescope has to be at the center because it gives equal leverage or equal justice to your right and the left hand. There is no fighting of the instrument, and any kind of maneuver if you are going to do, this is going to be much comfortable. Best position to put in the telescope is umbilicus, gives a good cosmetic results and forms the center of an abdomen. Second is the manipulation angle, which is the angle formed between the two ports and the target organ, which should be 60 degree. No wide angle is good, no small angle is good, because any kind of movement what we do or regular activity what we do is by 60 degrees. Azimuth angle is basically a bisection of the manipulation angle, That means indirectly it's an angle formed between the telescope, the target organ and one of the port. Ideally it has to be 30 degree, but 15 degree leverage here and there can be is always good to have, because it gives a safety margin in case you are mistaken by putting a first port. Okay, and the third and the important angle is the elevation angle. Ideally the angle again has to be 30 degree, not too close, not too far. Too close acts like a type 2 lever. Chances of electrical injuries are very high, manipulations are going to be difficult. Too smaller angle, again same thing, type 3 lever action, manipulation is going to be difficult, and here also there is an injury, but the injury is typically kind of a physical injury. Okay, so with this we come to an end of topic on ergonomics in laparoscopic surgery.